The Arizona Department of Health Services is working to combat the opioid epidemic across the state, taking new measures to find solutions.
Cronkite News reporter Bryce Newberry joins us live with a look at the progress so far.
Imani Eliav, the state recently released a report about the progress made in 2018. We've been digging into the numbers, and these are some of the big ones. 1,375 suspected overdose deaths in Arizona in 2018, and 9,335 suspected overdoses last year. Now, 91% of those deaths were right here in Maricopa County. One way, of course, to stop an opioid overdose is with naloxone. Pharmacists in Arizona dispensed nearly 28,000 doses in 2018. And a couple of other stats that are interesting. 35% of people who had a suspected overdose were prescribed by 10 or more providers, and 26% of those people who had a suspected overdose last year had 20 or more prescriptions filled. This morning, we sat down with the state health department's leader of the opioid epidemic response. It turns out only about 38% of prescribers are following state law to check the state's controlled substances prescription monitoring system before prescribing opioids. But the state health department's assistant director says Arizona is a leader nationally in terms of responding to the epidemic.
The response that we put forward was a significant leap forward with a substantial amount of action occurring in a short period of time.
The state has come up with several solutions, like a hotline for people struggling with opioid addiction and increased access to naloxone.
Our efforts have been tremendous. We mustn't let up on that effort at all. We still are seeing an increase in overdoses and deaths, and that may be the case, unfortunately, for a while yet.
But for now, another element of the state's response is a curriculum for Arizona medical students.
This is landmark curriculum.
The state included schools across Arizona to create the curriculum, including Charlotte Thrall from ASU's College of Nursing and Health Innovation.
The goals were to effectively equip our students when they graduate to be able to appropriately treat acute and chronic pain issues, as well as treat substance use disorder. This is a crisis that our graduate students need to be prepared to intervene in.
Jessica Wagner is one of those students.
It goes back to the basics, like let's try ibuprofen, let's try Tylenol first, let's try physical therapy, let's try like biofeedback, let's try acupuncture.
Those basics are skills she plans to take into her career.
Graduating in 2019 as a prescriber and provider, I think I have a fresh view, fresh eyes on the opioid crisis, but coming out with an entirely new view and perspective on addiction and pain, I think is hugely beneficial.
The state held a curriculum training for medical school faculties late last year and plans to create a continuing education version of the same curriculum for professionals. Live in the broadcast center, Bryce Newberry, Cronkite News.